All right, the next disease we're going to look at is dental caries, but also referred to as cavities. And if you develop, or in the process of developing dental caries or cavities, you also have the occurrence of gingivitis and periodontitis. So those two terms are inflammation of specific areas surrounding the tooth. And so we want to look at what those are and then what the causative agent is in most cases. So, dental caries is also called tooth decay, as I just mentioned, along with cavities, and those three words or terms can be used interchangeably. This is actually the most common infectious disease of human beings, and it is found in almost every single person at some level. All right, and so because this is seen in everyone, and depending on the level, all right, some symptoms may not be noticeable. All right, and the symptoms will range from minor disruption to the outer enamel surface of the tooth, which would be possibly a very low-level cavity, maybe just a little inflammation at the base of the tooth and the gum, which would be your gingivitis, or to complete destruction of the enamel, which would be the true cavity, or destruction of deeper layers, which would be the the periodontitis. Alright, so you have different stages in plaque development and cariogenesis, the development of dental caries. So you have the top picture of your tooth, the surface of the tooth, and the beginning of the cavity is right here. Alright, where you have the acquired pellicle, and the tooth is covered by the enamel, and you develop this pellicle, which is just a simple lining or covering of the tooth. And this is generally polysaccharide, so carbohydrate, sugar in nature, and that allows the bacteria to come in and sit next to your teeth. This is why it's important to brush your teeth on a fairly common basis to clear out that pellicle, because not only does it come from food, but any residual sugars, maybe some proteins that are naturally produced in the mouth, can aid in the formation of that pellicle. All right, now, the bacteria come here and sit on the surface of your tooth, and what do? They go through metabolism. All right, so they are going to degrade the tooth, degrade the tooth, but degrade the food that's in your mouth for their benefit. So they're going to replicate. And in that process of metabolism and replication, they're also going to create garbage. All right, they produce acid. All right, and the acid formation down here starts to degrade the enamel of your tooth. So this is why it's important not to eat right before bed, without going to bed, without brushing your teeth before going to bed, because that food gets stuck between your teeth on the surface of your molars, and the bacteria that are already in your mouth have a party overnight. All right, and they continue to produce acid and all their garbage, and that degrades the tooth. And so here you have the stages of cariogenesis, where the bacteria are attached to the tooth, and you have the beginning of the degradation. So, and then you have further destruction, which is then getting down into the pulp of the tooth. And at this point, maybe you're looking at having to have a root canal, which are not fun. So then the causative agent in most cases is going to be Streptococcus mutans. All right, they mutate your teeth. This is a very normal oral organism, normal flora within the mouth in the majority of all people. But generally, when you are talking about dental caries, it's going to be a mixed species. All right, because there are so many different bacteria in our mouth, it's hard to actually say this cavity was caused by X organism, even though we know that Streptococcus mutans is a major player. And that's simply because of its ability to degrade food and to produce high amounts of acid. Alright, so looking at the different stages, gingivitis is the initial stage of periodontal disease. And the signs of gingivitis are swelling of the gum. Alright, so the gingiva right next to the tooth. There can be patches of redness. With that swelling, you have loss of normal contour and bleeding of the gum. So if you brush your teeth and you have high amounts of bleeding, right, your gums are swollen. Right, there's irritation there, but maybe it's been a couple of days since you've brushed your teeth. And hopefully this doesn't really apply to many of you taking this class, but say your kids, my kids for sure, alright, if they're not told and sometimes even watched brushing their teeth, they may not do it. And so then they're like, oh no, my gums are bleeding, I can't brush my teeth. Now you go through that process of getting rid of that inflammation, and you then no longer have any bleeding because your gums are healthy and they can withstand the micro trauma of actually brushing your teeth. Then periodontitis, that is going to occur if the gingivitis persists. Right, you never brush your teeth, a person never brushes their teeth, and that degradation continues through the gingiva down toward the bone pockets. All right, and so this can cause bone resorption. All right, so you decrease the bone mass, which then can then cause the tooth to loosen in its socket, and the tooth can eventually be lost. And you've got a picture of that here. Here's the normal scenario. Everything is nice and healthy, but with the calculus buildup, right, the tartar, the stuff that the gentle hygienist has to scrape off. All right, that is constant inflammation or constant irritation causing constant inflammation. And now you have the reddening of the gingiva here. And it's starting to lose its normal contour. It's not nearly as thick. It doesn't attach or come up along the bone here. All right, and then here is periodontitis, where in this middle part, you see a lack of bone. And look at how much space is there. And the tartar is continuing to build up. Alright, so here are some mouth issues. Very severe gum loss, deterioration, bone resorption. These pictures, I think I got off of Google when I Googled trench mouth. Right, trench mouth is kind of a slang for this occurrence, and it arose from, I think it was World War I, where soldiers were in the trenches for weeks, maybe months, and obviously they didn't have the ability to brush their teeth. And soldiers would come home like this, or this is what they would be experiencing, and this is just really gross. All right. And even this occurs worldwide today, right, with individuals who don't have access to good dental care.